welcome everyone. We got a great attendance for this very interesting webinar that we're putting on today. I am Coletta Dorado. I'm the founder and CEO of AZZLY and your moderator today. Thank you for joining. According to Feeding America, 44 million people in the United States face hunger, including 1 in 5 children. As you saw in our white paper, America's Mental Health Challenges, food insecurity is linked to higher rates of depression, anxiety, and opioid-related overdose deaths. Still, we see all over the country that many of the counties facing high rates of food insecurity are the same counties that lack mental health and substance use services. So we were incredibly inspired by the mission of Nourishing Hope out of Chicago, Illinois, to address both hunger and mental health by providing their services in their food pantry setting. We believe these efforts serve as an innovative model to solve community-level challenges. And we're also grateful to have Soulfire Health here today to discuss this connection between hunger and mental health and the practical challenges in getting people to take first steps, even in the community setting. We also have Carol Gorbett. Carol Gorbett is an expert credentialer. What we've discovered for many new treatment centers that are opening up, the credentialing of their services and potentially their facility first is critical in making sure that the services that they're provided can be reimbursed. So we're very excited to start. And first, I'll introduce Jennie Hull. Jennie Hull is Chief Program Officer for Nourishing Hope. In her role, she sees all client-facing programs. A licensed clinical professional counselor, Jennie launched Nourishing Hope's growing mental health counseling program in 2017, and she continues to see clients today at this facility. Next, we have Csilla Megyeri. Csilla is a licensed clinical social worker, and she is Director of Social Services at Nourishing Hope, where she leads the mental health and social services team. Csilla is passionate about helping people achieve their goals and break the cycle of generational trauma through counseling and case management services. We also have from Soulfire Health, Sarah Bigbee. Sarah brings years of personal experience as a clinic dietitian to the conversation. In San Diego, Sarah worked in both inpatient and outpatient psychiatric care, addressing the role of nutrition and food insecurity. Sarah is active in bringing practical solutions to her community for addressing food insecurity, such as bringing SNAP benefits to the Bend Farmers Market in Oregon, where she also sits on the board of directors. And finally, from the AZZLY team, we have Carol Gorbett. Carol brings more than 20 years of experience with state and local payers, with a specialty in behavioral health. For anyone providing mental health services, proper credentialing is a necessary first step. So we look forward to all these panelists sharing with us their experience today. So hopefully we can broaden what's happening in America and serve more. So let's begin. Jennie, how big a problem does this country have with food insecurity and mental health? And how close is this relationship?
Well, Coletta, we know that the needs of people we serve extend well beyond food. There's strong national data connecting food insecurity to heightened prevalence of mental health struggles. A recent study concluded that people struggling with hunger face a 257% higher risk of anxiety and 253% higher risk of depression. Even in our own client survey, 36% of the people that we reported that they experienced systematic depression and 25% experience feelings of anxiety. So there may be many reasons for this. Common barriers to treatment include a lack of insurance access, insufficient finances to cover costs, or shortages in local availability of mental health services. And the COVID-19 pandemic really only exacerbated the prevalence of food insecurity and mental illness across the country. For several months, the state and federal government Programs are helping people weather the storm, but that safety net has largely disappeared. For example, the eviction moratorium that protected Chicago households from eviction as they grappled with income loss has ended, putting many families in a stressful situation of choosing between paying their rent, going to the doctor, or putting food on the table. So we knew we had to do more than just treat, well, we knew we had to do more to treat the whole person at Nourishing Hope, which is why we've also strived to do since 1970, was when we were founded. And we're proud that our mental health program continues to grow and serve the needs of our clients.
So Jennie, how unique is offering a mental health service in a food pantry setting? And are there any associations or organizations that support this effort?
It's extremely rare to find free mental health counseling in a food pantry setting. And that's kind of the point of it, right? We know that people that turn to us for food have complex needs. So we want to help them with the immediate need of food and the longer term need of mental wellness. And we want our clients to have the resources that they need to thrive. It's common for some food pantries to offer case management or connecting people to resources like jobs and housing. And that's important. We do that too. But it's less common to have free trauma-informed therapy with clinicians who are licensed or on the path to become licensed. So offering mental health in a food pantry setting, we're reducing barriers and making it easier for folks to receive the care that they might not otherwise receive. In terms of associations or organizations, our mental health program has been, a lot of support has come from the Chicago Department of Public Health, which we are extremely grateful for. And also just steadfast donors who believe in the importance of the work as much as we do.
Jennie, I was blessed to have the opportunity, and you were gracious to invite my team to come to your big gala last year. And I was so impressed with the number of volunteers that you have in your organization. And I know that that is huge. So very, very impressive with all that you do. Qualifying in order to offer these services, how tough a challenge is that?
So as Jennie mentioned,
Yeah, Csilla, thank you.
yeah,
Cheers.
as Jennie mentioned, we're a unique model, right? So we provide access to food in the same place that we offer case management and mental health or counseling to our clients. We are client-centered in our approach, meaning that we meet clients where they're at and let them be the experts on their needs and on their goals. When we register new clients turning to us for food, we always share information about our case management and counseling programming. We invite these community members to engage in the programs, but only if they're interested. Through experience, we know that clients will let us know when they're ready to engage with our clinical team. We will assess their needs and better understand their goals to make sure our approach is the right one. And if it isn't, then we'll do our best to get them connected to the right provider, to the right clinical team. Our qualifications are just that a client is willing to engage with us. They don't need anything else. We want to make sure we provide as few barriers as possible to our treatment team.
And it's not only potentially an individual, it's an entire family that presents for services. That's what, Csilla, that's what's beautiful with it being offered through your pantry. You get to touch as many as you can and the whole family. So very special. So Sarah, someone with your background, licensed as a dietitian, working in this area, share your experience with the connection between food insecurity and mental health and the challenges with getting individuals and families to take a first step, which sounds like Csilla and Jennie and their team have really something special here.
Absolutely. Before I jump into my personal experience, I just want to give a very basic description of sort of the two phases of mental health, the chronic phase and that acute phase. And so people experiencing that chronic phase are defined by having persistent debilitating psychiatric symptoms. And when all is going well, they're being treated using therapy, medications, and lifestyle and behavior changes to maintain that healthy mental hygiene. People experiencing the acute phase of mental illness are going through severe psychiatric symptoms similar to a flare-up of a condition. So people with a chronic condition may enter into that acute phase when triggered or when something happens that changes what's going on. People experiencing an acute phase of mental illness tend to not be caring for themselves. So they might not be taking that medication anymore, not eating well, not sleeping, and then leading to that self-medication habit, which is really scary. So now that I've defined those, I'd love to speak about my personal experience during my time in outpatient mental health care. I was able to see our patients with chronic conditions improve through providing them good nutrition and outpatient services like therapy and peer-to-peer learning opportunities. They were able to become healthy citizens again who were able to have highly functioning positions in society. Unfortunately, one of the first signs of a breakdown to this controlled mental illness was sudden weight loss and a decrease in physical health, along with no longer attending our outpatient programs. Mental health and our physical health and nutrition status, along with food security, which is kind of financial health, are all interrelated. And since these are all related, taking a whole body, whole person approach to our health is more important than ever. And there's no better evidence in the nutrition world of the whole body approach being important than that gut-brain axis. This is a communication highway, and it's continuing to be researched and explored. But what we now know is that our gut and brain are in constant communication. When we don't eat well and feed our bodies what they need, our mental health suffers. And when our mental health is suffering, we don't eat well. Experiencing food insecurity may cause us not to eat well, which ultimately leads to a poor nutrition status, not to mention the potential for serious disease states like diabetes, obesity, and malnutrition. This can then contribute to the mental health crisis, especially for someone already experiencing a chronic mental illness. So by getting these mental health services into hunger relief centers, we may be able to catch someone before the mental health crisis occurs. The main challenge that I see when it comes to utilizing services is kind of similar to what Jennie said. It's a daunting task. There tends to be a lot of steps required for receiving benefits and treatment. And if an individual or family is already experiencing increased stress due to poor physical, mental, or financial health, this may be a hurdle that they don't feel capable of tackling. And that's not even to mention the burden of transportation between these numerous services. So what Nourishing Hope is doing by offering mental health services in a hunger relief setting, they're making the process less daunting. They're giving people the opportunity to get these services in the community where they actually are. And so it's just such an incredible thing to see.
Wonderful, Sarah. She's an advocate, that's for sure. I love it. Jennie, what prompted your decision to integrate mental health services into your food pantry? And how did this support Nourishing Hope's overall mission, or did you have to do a lot of convincing?
Yeah, so I'm a licensed clinician, and I've worked in both private practice and in nonprofit settings. And obviously, this is a passion of mine. And I've seen over and over how mental health counseling can improve someone's life. I first had the idea to integrate mental health services here at Nourishing Hope in 2014. The city of Chicago had lost a vast majority of its own mental health clinics at this time. The city had shut them out. And this was devastating for many of the people in the city. And the organization at the time, Nourishing Hope, was much different. And we weren't really ready to take this on, didn't have the capacity. But come a couple of years later, 2017, we were able to start our mental health program. And we started very small. It was just an intern and a licensed supervisor. That's it. But we knew that the need was immense, and we just had to do it. So across the city, there just wasn't there was a shortage of free services. I would say to this day, there still is. You know, the folks that we serve, many of them cannot afford even the lowest sliding scale. So they need free. Or, you know, during this time, during 2014, when I thought of this, like, people were waiting 6 months to get in to see a therapist, and that just wasn't okay for where they were. And so just, again, having that skill set, I was like, this is something we could do. We should totally do this. And I'm so grateful that our CEO, Kelly O'Connell, saw the potential of the program, and it saw how it dovetailed with our mission of food for today and hope for tomorrow, So the food is literally, as we say, a carrot to get someone to kind of come in, get to know us, see that we are the kind of people that we are, the kind of agency that we are, and maybe take that extra step to literally just walk into someone's office right next to the pantry and talk to a clinician or a case manager.
So Kelly, how have you been able to grow the program? Is it a combination of working with politicians, regulators, payers, and do you qualify for Medicaid? Can you get reimbursed for the services you offered now?
So we've grown very gradually since 2017, and the funding's grown to support it. We've really found a lot of support from city and local elected officials who understand the impact of this work. We've received grant funding through the Chicago Department of Public Health, which I mentioned before. They have a trauma-informed centers of care, which was basically embedding mental health work into communities where people are already gathering. So it really fit for us. And while we hope that we continue to receive city funding, as anyone who works in a city knows, you get a new mayor, they have a new plan. So we'll see what happens. We're only a year into this mayor, so we'll see what he decides in the future. But we're also trying to diversify our funding streams so that we can support this program over time. We have some very committed donors who understand this, have passion for this work. And we also have foundations and institutional partnerships that are also very supportive too. And we have begun to bill Medicaid. It's been a process for us, as we have not done it before. But that's also just a revenue stream to help support the work. And for nonprofits, it doesn't matter what your work you're doing, funding is always the most challenging. But we're hopeful that this mission is so impactful and important that people will understand and continue to fund us and let us continue to grow.
Excellent, great, yeah. The billing team of AZZLY was excited to see, yes, Medicaid, they can bill now. So wonderful. Csilla, when it comes to staffing, share with us what experience or licensure you're looking for when creating your care team for this unique opportunity. And were you able to find qualified providers that were as passionate as you all are to work in this environment?
Yeah, so our staff are either licensed or on the path to licensure. While we think it's very important to hire staff with educational qualifications, we also see it as important to hire staff who understand our mission from their own personal experiences. When we look to hire case managers or therapists at Nourishing Hope, we're looking for individuals who are passionate about providing support in a trauma-informed, client-centered approach. We want staff members working with clients who understand that these community members, these individuals, are the experts on their own lives. They're the ones to best understand their needs and best understand how their needs relate to their goals. Moving a little bit beyond just the clinical work and the direct clinical work, we also look for staff members who understand the complexities that show up in the work, making them really appreciate how unique our approach is and why we're doing what we're doing in the way that we're doing it. Most of our staff actually heard of Nourishing Hope prior to working here, and I think that really talks about how positively the community resonates with our work.
I can imagine. I can imagine. That's because that you have to have the passion that you all have to work in the environment that you work. It's so moving. Let's move to Sarah now. Sarah, back as your experience as a dietitian, is there a stigma with food insecurity? And what experience do you have to support the approach of providing mental health services in a hunger relief setting?
So the very simple answer to a very multifaceted question is yes, there is a stigma when it comes to food insecurity. It's embedded in our culture. It seems to have roots in that, pull yourself up by your bootstraps, anyone can succeed mentality that our country, prides itself on. I think that this stigma is starting to change. We see a lot more mental health services out there. There's a lot more access points, which is awesome. In my experience, anytime we can engage with people who are struggling with mental health, we have an opportunity to help improve their health status. Not everyone experiencing poor mental health realizes it while they're in the thick of it. So giving them access to a mental health service in a friendly, safe, non-clinical environment is a fantastic way to help them identify what's going on and give them the opportunity for a starting point towards improved health status. And what Nourishing Hope is doing by allowing this access point and giving everyone the opportunity to have access and to help find the level of care they need is really special.
Agreed. Absolutely agreed. So Jennie, you talking about your programs and what you've created here, and the fact that for the average person to find an opening to see a counselor was 6 months or greater. Is it similar? What you're offering, is it similar to a typical outpatient or IOP counseling practice, or is what you offer unique?
I'd say what I usually like to tell people to make it easy and something that people can understand is that it's just like a private practice, right? So you're coming once a week for an hour for the most part. Now, there's some folks who will need more, but if you're going to need that more than just an hour a week, we assume that you're outside our level of care. And we'll provide a warm handoff to the correct level of care for you, whether that be IOP or PHP. We also have counseling groups, which I think are awesome because a lot of our folks are isolated. So a counseling group inherently is very helpful. We've had groups specifically for LGBTQ folks who are on their journeys of embracing their identities. We currently have a group for migrant women, which is obviously we've been seeing a lot of new arrivals in our city. And so I can't imagine how those women feel to be connected to other women who've been on a similar journey. And if someone's, like I said, if someone's needs are more than what we can provide, we are always making sure we provide a proper referral. And of our locations, we have 4. 3 of our locations have therapists in them performing therapy every week. And then we also offer telehealth. And that's important for folks who, being in a situation where you don't have a lot of income or no income, traveling from place to place gets really difficult. And I would say in terms of serving in a food pantry, the biggest issue that I run into, and I am sure Csilla has run into, is that it's really important to set good boundaries. So someone knows they're getting a lot of needs met through us and may ask their therapist about a food program or case management. And because we have other great coworkers, we can refer them over to. But I think the biggest thing is keeping those lines really clear.
Good point. Very good point. What practical steps, Jennie, can you offer for these first steps for someone who's attending or will listen to this? What are the first steps?
Well, you need to get your board and your CEO on board as well. So making sure that they understand the importance of this work. I mean, I think this webinar is a great example of that. There's all kinds of literature, which we've also been talking about out there to say why this is important and needed. And so, having that data is extremely clear. It's also not that mental health is some kind of add-on or mission creep. It's essential to the work that we're already doing. It's another level of it. And then really it's funding and building the model. You need to have somebody who can clinically supervise this. So someone who is fully licensed and able to do that. And you can start with graduate level interns as a way to kind of save on costs until you're able to build out more from there.
Excellent, excellent. And one of the features in their program, which has been extremely helpful for that, is the supervisory role. So you can have unlicensed individuals who can provide services that are supervised properly by a licensed individual. And Csilla, I think that's something that appealed to you with your growing staff and those that you're putting through training. And I also think it's wonderful that you're offering opportunities to students and grad students to come into a profession that needs them, that absolutely needs them, and you're opening up a door. So you mentioned, Jennie, about, taking advantage of grants, private funding, public. Is that kind of part of that first step, trying to build some support locally in the funding community?
Yes, I would definitely say that it is. I mean, the impact of our first government money from the Chicago Department of Public Health was transformational. I mean, we went from an intern or 2 to 4 or 5 staff, which has been incredible. It's also, just like I said, diversifying your funding. So Medicaid is a consistent source of funding once you get started with it. So I would encourage people, I mean, as much as Medicaid, has its own challenges, it is a consistent source of funding. And obviously many of the folks we work with qualify for Medicaid. So it makes sense. But I think it's also just continuing to tell the story to donors. And really foundations are interested in this kind of work too. So, you know, looking out for grants that will fit this, applying for those.
Now, Jenny, very good point, because we've seen from this current administration tremendous amount of money going into at the state and federal level to support the mental health needs, to support the substance use disorder that's going out, but very much focused on mental health, which you didn't really see this much money come in this direction for a long time. Grant writing is a challenge. So who I'm going to throw a question out there that I hadn't planned on, but Csilla, Jenny, do you have a grant writer?
We have a
Yeah,
grant writer. Yeah, but I will say Csilla and I do a lot of the writing, the program writing ourselves. And I will say, once you start the process, you can use that kind of boilerplate moving forward. So you don't have to reinvent the wheel every time you apply. Sorry, Csilla, to cut you off.
Great, not a problem.
Was there anything else, Csilla, you want to comment?
No, that was perfect.
Team effort, in other words. Okay, Carol, we didn't forget about you. Let's talk about credentialing, as Jenny and Csilla mentioned, credentialing and getting yourself that first facility credentialed or provider credentialed, especially with Medicaid, can be a challenge. So Carol, can you share how important it is to get credentialed, and is there any such thing as starting too early?
No, there's never a such thing as starting too early if you have the information to submit to the insurance companies. You have to have the documentation to support what you're asking for or what you want. And this process is extremely important. Basically to get paid, right? That's why we do it. Credentialing equals money. So in order to get reimbursed, you need to get the organization and the providers, depending on how your business is set up, credentialed with the insurance companies.
And so the ability to get reimbursed by Medicaid, which is obviously why you went in that direction, Jenny, there's coverage in Medicaid. So if you can be reimbursed, you got to go for it. You mentioned about sliding scale in cash, but you're in a situation where cash is king and not available. You have to rely on all the resources from the community, from grant, local, federal, as well as Medicaid. And I think your movement in that direction, and I know it took you a while to get it, you know, what was 3-6 months? What on average, was it about 6 months?
Yes, and we had a consultant that had to help us kind of get through that, because it was, you know, so new for us. We just did not have not done that before. So it was tricky. And to your point, Coletta, too, like we want to offer free services. That's a big part of our mission. So we are going to accept Medicaid when we can, but we still want to offer those free services. And there are reasons why people can't qualify for Medicaid. You know, we have people who, you know, are undocumented immigrants, so they cannot do that. People changing jobs, qualifying for Medicaid and then staying on Medicaid in itself can be a huge burden for folks. So we want to be able to keep this. And there's also other reasons why, even if someone has Medicaid, we may not bill, just because it either doesn't make sense for that client or there's some kind of ethical issue. So it's just a really case by case kind of choice that we have to make.
Yeah, and you're not alone, because we're dealing with a organization, a non-for-profit out of California, just phenomenal, passionate group, working with homeless, not the food element, homeless, and then another group in Buffalo, New York, that God bless them after the shooting at that Tops grocery store. You know, the community, and I'm a Buffalonian, so I'm very proud of the area I come from, but the community really stepped forward to try to help and try to encourage, Csilla, the mental health aspect, right? In introducing it. And there really wasn't that network built within that community to offer services. They were they were pretty shocked at the lack of services offered. And so it just reminded me, I said, you got to speak to Jennie, you got to speak to Csilla. There's got to be a way that as a group, as a passionate group, that y'all can get a momentum going, and we're all in, because to us, it's delivering you a technology that can work on the business side and the clinical side. And if we can make it affordable and we can start a movement like this, I would feel incredibly grateful for that opportunity. So, Carol, the last thing on credentialing, because I've seen the required documentation, and it isn't always easy. It's a lot. And you're talking group, you're talking individuals, you're talking payers, who are you going after? Can you touch upon the importance of getting a facility, a group done, and then also the individuals for organizations that might be starting in mental health for the first time?
Yeah, so when you're talking about facilities, you would need the license for the actual organization or the business. In some cases, the insurance companies might want to see that you're accredited with some sort of national accrediting body. If you're not accredited, they could potentially come out and do a site visit and make sure, all your ducks are in a row. That's why facilities could take longer in the process of credentialing than individuals, because of the fact that they may want to come out and do site visits. And we're talking about each payer that you want to be credentialed with. In addition to that, some organizations want to credential individual clinicians who are eligible. Not all clinicians are eligible. They usually have to have that clinical license or clinical designation on their license.
Mm-hmm.
And then for that, we need, of course, their diploma, transcripts, their license. Now, insurance company utilize a national repository of information called CAQH, and each provider has to have a CAQH profile in order to get credentialed with most insurance companies. And so, yeah, it's a lot. It's a lot of information. It's a lot of putting it all together and then submitting it to the insurance companies, and then do the follow-ups and yell and scream and temper tantrums to get it to go through.
Carol, is credentialing or re-credentialing something a practice, a facility could do on their own?
I don't recommend it because you want to focus on the important things, and that's servicing the community, servicing the members. That's where the focus should lie for organizations, and leave the credentialing to people who that's all they do, because it really takes the credentialer a lot of time to communicate with the insurance companies and push this process through. It is extremely time consuming, and that's what a lot of people don't get, that it's really difficult to juggle both. Building a business, servicing members, and then on the side, you're going to do credentialing. I do not recommend that at all. I recommend a company or an experienced person do that for you. And then that part of it, you don't have to worry about.
Carol, I've witnessed that with individuals that think that by contacting you every single day, it's going to make a difference.
No,
unfortunately, it doesn't, because if they've provided all of the proper documentation to you, you submit, then it's your job to touch regularly those contacts that you have within a state,
right,
within Medicaid, to say, hey, where are we? And so patience, my mother taught me, patience is a virtue, right? Not all of us have it. But I have seen that, 30, 60, they start communicating with you slowly.
yeah,
And you just have to have patience, but someone who's monitoring it. And you're absolutely right. Many of the if a new treatment center is spinning off from a larger one, a group got together and they really want to open up in a particular area, it's really important to have the experts surround you. And that would be a credentialer. And also, I'll give a plug for AZZLY. One of the things that amazes me in mental health and substance use disorder is the amount of small organizations that are still paper-based, or they're just on a documenting system. They haven't graduated to the use of today's technology. So Jennie and Csilla, give AZZLY a plug.
Well, AZZLY is our first ever provider of electronic health records. We were paper-based until a few months ago. It's not even been a whole year. And that was obviously it was becoming an issue, and honestly becoming a real liability for us. So our relationship with AZZLY has been great so far. We really vetted a lot of different providers. And we're pretty small. We don't offer a ton of services that we would put into an EHR. And so we love that first of all, we love that your team is so accessible, and that the system is so customizable. There's so much that AZZLY can do. And even if we only need this much of it, AZZLY can make that happen too. So it's really helped take us to a new level of professionalism, by working with AZZLY.
Great, thank you. Csilla, on the clinical side.
We were so impressed with you all from the beginning. Sorry, my voice is going away. You all took your time to understand what makes us unique. And I think just that, those first couple of meetings, understanding who we are and what we do really helped us work together to create a customizable platform that is exactly what we need. So you're always willing to listen, always willing to bring an experience and a product to us to let us do what we do best, which is serving our community members in need.
Excellent. Well, thank you so much for that. Again, I'm going to remind everyone that's on the call that there's a Q&A box. You can enter some questions. We did get some questions that were submitted prior. So, I want to thank this panel. I've always learned a lot. I always enjoy hearing different perspectives. Sarah, it was great to hear you from that dietitian end. Jennie, you're the business mind. You're the one that, created this opportunity for Nourishing Hope. And Csilla, you're just so hands-on. And I like the fact that I always say, communicate, communicate, communicate. If any vendor that you work with, if you don't communicate with us, we don't know what we don't know. And you've been great bringing different members to the team and say, hey, Coletta, can you do a Salesforce interface for us? Yeah, let's talk about this. Let me see what I can do. And we accomplish it. So, you're excellent with your communication skills and engaging us. So I thank you for that. And I thank you for the opportunity to serve you. By the way, everybody in attendance, they got a great fundraiser coming up in the fall. It is a wonderful auction gala. I've never seen anything like it. It was a lot of fun to attend. So thank you on that. If they have anyone in the audience or anyone that listens to this recording, who can they talk to at Nourishing Hope that might be able to give them some guidance?
That would be me. So folks can reach out to me. My email is Jennie, JENNIE.HULL @nourishinghopeshy.org. You also can just find me on the website too, but please reach out via email and be happy to talk with folks. I've talked with people across the country about this model and how to replicate it in a food pantry or food insecurity space. So
excellent, great. Can we put her email in chat or in the Q&A, Andrew, so that people have individuals? And I'm new to AZZLY platform, and it's growing at Westminster Rescue Mission. John Gill. Yeah. Oh, that's another great group, Westminster Rescue Mission. So we're very blessed. We've got those that we serve are non-for-profit as well as for-profit organization. We're very fortunate that we're able to configure affordable solutions that can be used by all, small, medium, and large. So thank you so much, John, for putting that up there. A question came in about how receptive, Jennie, our individuals and families to your mental health programs. Is it growing? Do you see movement?
Yeah, unfortunately, we can't keep up with the demand. And I think that's probably always going to be true. I don't think we'll ever be big enough to meet it because of that free, extremely accessible service and just how unusual that is. I also, you know, to Chilla's point that she made earlier, our clinicians represent folks in the community, and they speak a variety of languages, which is, again, so important. So I think clients are probably people who came to the food pantry, are probably the people that came and saw us in therapy, are probably people who maybe wouldn't have, and you know, gone to a clinic or gone to a practice, and it's easier for them to come to us. And so they've been really receptive. I will say the community at large has been receptive. You know, this is an innovative model. People see the need more and more for mental health services and understand that it needs to be embedded throughout the community. So we've gotten, I mean, there's not been a negative word about it. And we're thrilled to hear that.
That's wonderful. Sarah, and I agree with you. That's why we're hoping more and more reach out to you, learn. And even if you're not a food pantry, if you know of a food pantry in your community, please encourage, I think, meet the individuals where they feel comfortable. You've done it. You have absolutely nailed it. Now, Sarah, when I went to the gala, I was impressed with this enormous wagon and all the amazing vegetables and fruits and healthy things that I saw. Jennie, you obviously have a resource of getting really good product. And I think, Sarah, to your point, making sure that it isn't just a block of Velveeta cheese, right? So Sarah, you want to comment on that?
Yes. You know, the healthier food you can provide, the better. And then also access to recipes is another great option. I don't know specifically what your food pantry provides, but you know, I know at Soulfire Health, we have an app that does let you type in, you know, like say venison, you've never cooked with it, you don't know what it is. You can find a whole list of recipes that help support that protein that you've never worked with before. But the healthier food you can provide, the healthier your people are going to feel, and the better they're going to be, and the more receptive they're going to be.
Wonderful. Well, thank you so much. So being respectful of time, I think we've done darn well. We're three minutes away. I really just want to thank you all for your time today. I'm encouraged. I hope that, Jennie, that you get contacted by more and more individuals within the United States. And I hope there's a growing movement that we can help support. And don't be afraid, right? Don't be afraid to start. You can always start somewhere. And like Csilla, you said, it could be volunteers, it could be graduate students, right? There's universities in every setting. What a fabulous way to get this going. Rebecca is on board. Rebecca McKinnon, she's based out in the Kansas area and works with quite a few programs throughout the United States. So thank you so much, everyone, for attending. Thank you to the panelists. I hope we can do this again. And I'm inspired. I really am inspired. So Carol and Sarah and Csilla and Jennie, thank you. We want to continue just educating all that are out there about the mental health needs, the opportunities that are out there. We work with easy start plan we put up on our website to encourage those that are thinking about it, but you're afraid of price, to just fill it out a little bit and get an idea of what it might cost you to move to technology to start growing your business. So it's the Easy Start Plan on AZZLY's website. Don't be afraid. The need is great. And again, thank you to our panelists. Thank you for everyone attending, and look forward to the next webinar.